Community health workers, or CHWs, are frontline public health workers. They have a very close understanding of the community they serve, and they help connect people to the services they need. These services could include navigating the healthcare system, encouraging preventive care, offering resources for managing chronic illnesses, maintaining healthy lifestyles, and assisting in culturally and linguistically relevant ways. For a long time, various communities and organizations across Arizona have employed CHWs. At least 5 Access contracted health plans and at least 19 of the 22 tribes in Arizona have CHWs. Now, these services can be reimbursed through Access. To receive reimbursement, community health worker organizations must become Access registered providers. It is important to note that Access doesn't register the individual CHW workers and instead enrolls the organization that the CHWs work for. When the CHW organization applies for Access enrollment, the organization will submit and maintain a list of all certified CHWs they work with, whether they are directly employed with the provider or are subcontracted and receiving a 1099. That list can be uploaded into APEP with the provider application. How does a CHW organization register as a provider? Registering as a provider is done in the APEP portal from the Access website, www.azaccess.gov/APEP. If you have never created an APEP account, you will first need to complete the new user registration. If you already have an account in APEP, you can start a new application for your CHW organization. Once you have successfully registered and logged into APEP, click the Provider tab on the top of the page. A drop-down will prompt you to start a new enrollment, track an application, or manage provider information. If you are registering as a new CHW organization, you will select New Enrollment. On the Enrollment Type page, select Atypical Agency under the enrollment type. Once you click Submit, it will take you to the application steps, and you will follow each step, filling out all the required information. Step 4 is where you will select your provider type. Click the blue hyperlink to open the step. Once Step 4 is open, select the Add button. A drop-down box will appear for the provider type. Select Community Health Worker Organization from that drop-down. When you arrive at Step 11, you need to upload the list of CHW employees, like was discussed earlier. Click on the link to Step 11 to open it. You can download the template from here. Follow the directions to enter the required information. When ready, upload the document. Fill out the rest of the application as prompted with the required information. Once the application is complete, there are a few more steps CHW organizations need to take for the enrollment process. CHWs are considered a high-risk provider, so in addition to the application in APEP, the following is required: a fingerprint-based criminal background check, or FCBC, for certain owners and/or controlling interests, a site visit, and an enrollment fee payment. The 2024 enrollment fee is $709. The application process can take 60 to 90 days from the date of the application. Sometimes a new application for your CHW organization may not be needed. If your organization is enrolled as one of these provider types, you can already bill for CHW services without a separate enrollment as a CHW organization. 638 FQHC, BH outpatient clinics, community/rural healthcare centers, DO physician osteopaths, federally qualified health centers, hospitals, integrated clinics, MD physicians, physician's assistants, and registered nurse practitioners. For any registered organization seeking reimbursement for CHW services, they must ensure that any CHW providing services is certified and that they are providing a medically necessary service as recommended by a physician or licensed practitioner. Records of all CHW's certifications must be kept up to date, accurate, and available to access upon request. You may employ CHWs that are not certified, but you will not be able to submit for reimbursement for services provided by the non-certified CHWs. Many Arizona members of Medicaid are enrolled in managed care plans. Enrolled CHW organizations will need to credential and contract with Access Contracted Health Plans to be reimbursed for services provided to members in a managed care organization, or MCO. Once approved as a contracted provider within the health plan's network, you will be working with the billing department for the appropriate billing practices. Any Access registered provider can provide services and be reimbursed for Access fee-for-service members, such as members enrolled in the American Indian Health Program, or AIHP, without being contracted with an MCO. Claims for CHW services may only use the following codes: 98960 for individual patients, 98961 for a group of 2 to 4 patients, and 98962 for a group of 5 to 8 patients. CHWs can bill in 30-minute increments for the services they provide. A maximum of 4 units up to 24 units per month per member can be billed. If additional services are medically necessary, prior authorization would be required. You have just learned about community health workers, how to register as a CHW organization provider, and billing as a CHW provider. If you would like further information regarding CHWs, you can view resources including the CHW page on the Access website, the Fee-for-Service, or FFS, Provider Billing Manual, and the Access Medical Policy Manual, or AMPM. These resources can be found by performing a search on the Access website. Thank you for all you do in helping our members in the community.